Each type of lymphedema has its own symptoms, its own progressions, and its own treatments. Welcome to my series. The many faces of lymphedema, primary, secondary, and beyond. This video explains the different types of lymphedema, how and when they develop, and why classification matters. Each type of lymphedema has its own symptoms, its own progressions, and its own treatments. The first type of lymphedema we're going to discuss is primary lymphedema. This is the type of lymphedema that is a condition of the lymphatic system from birth that has been underdeveloped. Lymph vessels may be fewer, they may be smaller, you may have less lymph nodes, or they just function less efficiently. Swelling could appear at birth, it could appear in adolescence, it could even emerge in adulthood. At some point when you have primary lymphedema, if the system gets overwhelmed, that's when the swelling begins to show up. Secondary lymphedema is lymphedema that shows up as a result of some type of trauma to the lymphatic system, cancer-related treatments to the lymphatic system, radiation, trauma, inflammation, infection. All of these things can contribute to secondary lymphedema, stressing the lymphatic system where the lymphatic system is less efficient, and then swelling begins to develop in the tissues. It can appear soon after the event, or it could take years to develop. This explains why someone can feel just fine after breast cancer surgeries and then 2 or 3 years later begin to develop some swelling. The lymphatic system has a way of compensating until it reaches a tipping point. And then that's when you're going to see the start of the accumulation. Lymphedema can also coexist with other conditions like venous insufficiency. So if the veins are unable to take up the water from the capillaries, from the blood capillaries, the way that it's supposed to, then it leaves the lymphatic system with the responsibility to take up more fluid than it's capable. Conditions with chronic inflammation can also put stressors on the lymphatic system and cause congestion. Also, conditions like lipedema, which is a chronic condition where the connective tissues are, if you will, looser than they should be. So if you are looking at your skin and your skin has more flexibility than it should, then it has less pressure to contain the fluid. So it allows more accumulation of fluid than usual. So with that condition, you can put more stress on the lymphatic system to the point where you start to go through different skin changes and things of that nature. And this is why lymphedema is not a one-size-fits-all type of condition. So it's important that you consult with a certified lymphedema therapist for your condition so they can recommend the proper treatments for you. So I hope that you learned a little bit more about lymphedema, about the different types of lymphedema. So which type are you, or which type is your loved one? And remember, like and subscribe so you don't miss out on any more educational videos in the future. My name is Dr. Tiffany Topp, and I'm an occupational therapist and certified lymphedema therapist.